There is no glory in hot flashes.
Hell no, feels like your damn cells are on fire,
Yeah, I
right?
don't know why you even wanna go through
I
it.
don't even know. Let's talk about it. Let's talk about it. It's the Health and
Mm-mm.
Wellness podcast. We talk about all things that have to do with your body, health and wellness. So,
Mhm.
Kat and I both are going through perimenopause. She started going through it first, and then I kind of learned from her. So, we're going to talk a little bit about what her symptoms were, and then we'll talk about what mine are because they're kind of
Yeah.
at different levels of the process. And you can see if maybe that's something you're going through, and we'll tell you what we did. All right. Kat, what was yours like?
We talk about periods now.
We do.
So, warning. So the first sign to me was, I'd go 3 months without having one and then have 2 in the next month, and it was not fun. It was exhausting. So I went to the doctor, like a good cat, and she said, "Well, surprise, surprise, you're in
Surprise,
perimenopause."
surprise.
You're in perimenopause. I said, "Okay. All right." So officially, I got my award for perimenopause. No, no, no sooner than I got home, I started having flashes. I said, "Oh no, no! Let me go find a telehealth." And Winona was the winner. Winner,
Uh-huh.
winner, chicken
Winter
dinner.
chicken dinner. Yeah, indeed.
Yep.
I know. And then I was like, okay, Kat. And I remember the time like you had started gaining weight and you were like, okay, like, do I need to watch my food? Do I need to exercise more? You like went the whole way, right? Like the whole
Yep.
gamut. And we were like troubleshooting it together because we besties, right?
Mhm.
And then it turned out it was this. Then I started going through it too. I got my gallbladder out. I started having
Mm,
hot flashes. I couldn't sleep for years. And
mm-mm.
I reeled it back in. Couldn't sleep, waking up at 3 a.m., wanting to
They're fun.
unalive everyone everywhere because they were all making me so mad.
Oh, the rage, the
I
rage.
couldn't stand it. Yeah, the rage. And I was like, "What is wrong with me? I'm actually very sweet when I'm not yelling at trolls about GLP-1s." And then I was like, "Okay, something's gotta be wrong." So I go and talk with Kat. She tells me she started HRT, the difference it's made. She started losing again. And I was having
Yeah.
very similar, but I still have a cycle. So we were like, "We gotta learn more about this." So we had on Dr. Kat, who is the chief medical officer for Winona, which is a telehealth that handles all things with perimenopause.
Mhm.
And so we were like, all right, we got to know all about this. We got to know all about this. And we had such a lovely episode. So if you want to learn more about that from a doctor, like go to that episode.
And
But
she's
if
a
you're having
GLP-1
these
friend.
symptoms, yeah. But if you're having these symptoms, then
Mhm.
definitely look into it. We have a code and a link and all the things to save you money. When you
Yep.
go, we're going to put it in the show notes and in the link tree so that you can go there. But this is definitely something that has helped us considerably. And your body's fluctuating like through this. So you need a good doctor and care and someone you can be like tweak
And
things with
that's the
because
key.
that's what's going on, man. Like
Yep.
there's no need to suffer, right? Like
There's
there's no need
no
to suffer.
glory in hot flashes,
No glory in hot flashes.
nor rage, because
No.
no,
Exactly. No. So don't think that just because you have started missing your periods yet that you're not in it. Like go get it checked
it
out
happened before.
and see if it helps you because it has helped us significantly, right? As Kat would say, it's clutch. So
What?
go to the link
Mhm.
in our bio, go ahead and look into it. We hope that it helps you and we love you.
We heard some promising benefits about obesity treatment medications and the benefits that they create for heart conditions. Um, Number one, can you expand on the medications and how they help? Additionally, I wanted to add this just personally because a lot of my friends will say, well, of course, it's going to do better for your heart because you're losing weight. However, I want to find, is there an actual correlation? Like, say, the study that came out that said wegovy actually improved heart conditions. What are those clinical results besides the actual weight loss?
Yes, yes. So, great question. All of this exciting discussion around GLP-1s and improving heart health or preventing heart disease really comes from one big study, which was called the SELECT trial,
Mhm.
which was presented and published at the end of 2023. And so, in this study, they looked at semaglutide in patients, adults who
Mhm.
had already had heart disease. And how did they define that? I mean, most of them, 2/3 of them, had had a history of heart attack, but they also included people who had had strokes or who had blockages in their legs or had had a heart stent or bypass surgery, something like that. But most of these were heart attack survivors, and they were like in their early 60s, BMI 33. Most were
Mhm.
actually pre-diabetic, so it's not like this was a totally normal sample in terms of insulin resistance. And their cholesterol and blood pressure was pretty good at baseline, like pretty close to, because they were on statin medications and probably other medications to help control blood pressure, which is a major risk factor. And they randomized this big population of patients to get semaglutide at 2.4, the maximum dose, or
Mhm.
placebo, fake medication. And then they followed them for only 40 months, as opposed to some of the other GLP-1 trials that look way out to like 72 months. Okay. And in that short time frame, they saw a 20% reduction in cardiac events like heart attacks, strokes, and death from heart related causes. They also saw fewer heart failure hospitalizations and events. So this really had a like much larger than expected effect for a shorter than expected time frame,
Mhm.
over which, people lost not as much weight as we see in the obesity studies, like
Yeah.
10% weight loss on average. So we'll get to sort of your question about, is it the weight or is it I think we can even get to it now. Like,
Yeah.
was this outcome because of weight loss? 10% is a lot, but like over just 40 months, it'd be hard to attribute that magnitude of a cardioprotective benefit to 10% weight loss. So, what else could be going on? This is where we sort of draw on other research that's been done on the impact of GLP-1s on the cardiovascular system. So, we know that it improves the function of that innermost lining, the endothelium, which is what dissected and caused the heart attack in Priscilla. It helps the
Mm.
endothelium and the
Mhm.
blood vessels relax more, which helps lower blood pressure. It also helps our body get rid of salt. We know that salt isn't amazing for us. If we GLP-1s promote release of something called atrial natriuretic peptide, or ANP, which is sort of like your body's natural blood pressure medication. It makes you urinate out salt and, make the kidneys work better, and with that control your blood pressure better. But then it does like a bunch of other things that are amazing for your heart health. It decreases inflammation. We know obesity has a big inflammatory component in its
Mhm.
biology. When
Yeah.
you measure markers of inflammation, this was as much as like 39% in this big study that we're talking about. And then it also decreases cholesterol levels. So, your bad cholesterol, LDL, by 5 to 7%, triglycerides, those fatty acids, by up to
Yeah.
25%, depending on the medication. And so all of this together in aggregate is probably why we saw such a pronounced protective benefit over a shorter time frame for like a medium amount of weight loss when we think about
Yeah.
all GLP-1s.
Uh-huh.
So that's sort of what we're looking at. And tirzepatide, a similar study is underway. And hopefully we'll see those results soon, but TBD, we're all sort of waiting on the edge of our seats.
Yeah. That's good. Mounjaro, or tirzepatide, what I am on, has definitely helped reduce my cholesterol. Although I kind of sort of attribute it to I didn't realize how many eggs I was consuming in a day just to get my protein in. And I had my blood taken and I was like, whoa. So it's egg whites for me.
Oh, egg whites, egg whites. Gotta love them.
I was so glad to see that number go down though. Woo.
Yes, it was so rewarding. It's really
Yeah.
rewarding, isn't it?
You want to know a hack to get insurance to cover your GLP-1 prescriptions? Here's the truth. Most people get denied the first time that they try, and insurance companies are betting that you're just going to give up. But you do have rights, and you can appeal not just once, but multiple times. The problem is the process is confusing and it's time consuming, and a lot of providers just don't have the bandwidth to be able to fight through it with you. So that's why I partnered with Claimable. It's an easy to use tool that helps you build expert backed appeals proven to work. So don't give up on your shot at coverage. Exhaust your appeals. Go to getclaimable.com/plus sides to learn more and use code plus sides with a Z to save.